I'm Philip Ward, Editor-in-Chief of Aunt Minnie Europe. A big issue this week at the European Congress of Radiology is management. And I'm pleased to have with me Dr. Leo Lawler from Dublin. Leo, welcome to ECR.
How are you, Philip?
And on Friday, there's a day dedicated, Leo, to management issues. Why do you think radiologists should care more and more about management issues, management topics?
Well, I think what we're finding, and I think you can see it here at ECR, is that we've spent a lot of time coming out of the dark rooms and the basements of hospitals and practices around the world, and radiology has become front and centre. And again, I think you can see at this meeting, like I wouldn't say we're plateauing, we have an awful lot of it to go in terms of innovation and technical developments in the whole clinical side. But I think most of the world accepts now that we are absolutely fundamental in the care pathway of patients. We're the fulcrum, we're the rate limiting step for an awful lot of what goes on. And as the spotlight has shifted from there, I think it's become increasingly obvious that we need to manage ourselves and be managed as a very precious resource that is absolutely fundamental to rapid, personalised healthcare.
Okay. Would you say that radiology has become, as it's become more valued, has it become more under the microscope? Are they more and more demanding about what they want from their radiologists?
I think so. I think our clinical colleagues, with very rare exceptions, have become utterly dependent on imaging for the management of their patients. And as this very precious resource is trying to meet all of their increasing demands, there are stresses, there are confrontations on resource and supply challenges, and it has meant that we've had to look inwardly to see, are we sweating our assets, are we getting the most out of them? But equally, I think we're looking out to hospitals and others and saying, well, look, if you do finally acknowledge this is fundamentally important, can we get a piece of the resources that are required for the care pathway? Because we simply can't keep doing more for less, because the wheels will come off this product, you know.
Now, a big issue, I think, is whether radiologists should be specialists or non-specialists, generalists. Yeah. What's your own feeling?
I mean, it's a very interesting question. I'd like to tell you I know the answer, but I don't, because I think it's very much dependent on your jurisdiction. If you have adequate resources to get the very best results, probably the most efficient use of your resources, probably the more specialised people are, the better. But there are countries in which it's simply not feasible to have a world populated by super specialist radiologists and nobody in a position to do general clearing of radiology. So you will find in many jurisdictions, and certainly as you will know in the Irish jurisdiction, one of our biggest issues nationally has been unread plain films. Yeah. It hasn't been unread perfusion brains, MRIs and so on. So I think it's a new challenge to where we're going about what is the profile of the population of radiologists. And probably what we want is to have well-staffed units that have a good body of people who can do very good general work, but have at their disposal within their community super specialists who they can refer to either in their immediate environment or through, PACS platforms and other, modern cloud technologies.
Excellent. It's interesting you mentioned PACS, and I was going to ask you for a brief update on how the PACS national project is doing in Ireland. What status are?
Well, I think most people would agree the national PACS project in Ireland, the so-called NIMIS project, has largely delivered on its brief. They're in the home stretch. There's light at the end of the tunnel in terms of actually having rolled out to almost every unit in the country. Most of the units that are up and working now have all so-called levels of hospitals interfacing. And we are definitely reaping the benefits of having an integrated system platform, for sure. Yeah.
Any difficulties? Any teething problems?
Well, again, yeah, absolutely. Just again, like all these things, as they come to fruition, and people have a perception of how it's all going to play out ultimately, but until it actually gets on the ground, you don't realise. And again, I think governance is the whole issue now. So it's not so much about the actual platform, and yes, it can do all the things it's supposed to, but how are we going to use it to best advantage? It's going to be contextualised in the Irish context, assuming when our new government is formed, hopefully. If they continue the pathway they're on, we're going to be forming more trusts, more networks, and the whole idea there being that for radiologists certainly, that these PACS platforms would be the internet for us to work off, to interface with all of our hospitals within our respective networks. And there will be challenges there for sure.
Yes. Yeah. The other very hot issue, I think, in Ireland is locum radiologists and their use. Is this debate still going on? Are there still some discussions of error rates by locum radiologists?
Well, like a lot of issues in the media, it had its spotlight, it had its time. I think it's gone off the boil at the moment. Again, we're in an election year. There's a lot of other things people maybe consider more important. I think it came out on maybe a slow news day and so on, and as we discussed before, some of the items that were raised maybe weren't well founded.
The difficulty, I think, is really of measuring standards of errors, of what expectations are in a small general hospital as against a university hospital.
Yeah, I think that's a very good observation, and I think it's a very valid point. I think, what is the problem in Ireland and in other places is the locum issue is a symptom of an under-resourced service. So just one of many symptoms, and we don't have enough radiologists, so we go out and buy radiologists. The terms and conditions in Ireland are such that it's very difficult to recruit people. It's very difficult to get our own people to come back from other jurisdictions where they have better terms and conditions and so on. So we get other people to do it. They're often from other countries, and we have a medical council that does their very best and tries to vet them and so forth. But at the end of the day, we're now in a country which is being staffed heavily by locums from various different jurisdictions. And I do feel at some level there is a fairness issue in that whenever there's an issue in a smaller centre, I think there is a tendency for those issues to be judged by individuals and organisations in big centres who have lots of colleagues, lots of resources available to them. And often you'll find a lot of these jobs are in very small units with very poor infrastructure, very few colleagues, very few people to support them. They don't have the benefits of multidisciplinary conferencing and so forth. And I think we probably need to start thinking differently about how we judge the standards. Should everybody be held to the standard of a radiologist practicing in a major university centre?
Excellent.
And so on. I think these are questions.
Thank you very much. We look forward to Friday's sessions on management and radiology, and enjoy your week in Vienna.
Thanks, Philip.